This is Inspirational Women, a weekly series shining the spotlight on female trailblazers making a true difference in our community. Once again, here is Kate Daniels.
February's here, and it's designated as American Heart Month. The American Heart Association's Go Red for Women movement is active during the month, raising awareness of heart disease in women. With us today is Therese Dumas, a 2026 Go Red for Women ambassador here in Washington State, who has a very unique perspective on heart disease. Therese, welcome.
Thank you. Thank you for having me.
I really appreciate your time. I appreciate what I know is going to be a story that you share with us, because you've had a long history of working in the cardiac nursing field. So in general, can you just give us an overview of what your experience has been?
I have worked as a cardiology nurse practitioner for the past 28 years. I've done inpatient cardiology, I've done outpatient cardiology, I've done cardiac cath lab, I've done exercise stress testing. I have done the whole gamut in cardiology.
Wow, that's a really big spectrum. So you would consider yourself to be really knowledgeable, well-versed in this field.
Yes, I think I'm pretty good.
Yes. And you've worked with both women and men.
Yes, I have.
And when it comes to heart disease, men, women, they're the same or not?
No, they're quite different. Men typically present with the traditional chest discomfort, pain across the chest, maybe going up to the neck, the jaw, and between the shoulder blades. Women present quite different. Most times, women don't necessarily present with chest pain. They come in with other symptoms, vague symptoms, more short of breath than usual, more fatigue than usual. Rarely do they come in with the classic, every time I walk, exert myself, I get chest pain, I stop and I rest, it goes away. Generally, women will not present that way.
So then it gets to feel really iffy. Like, how do I determine that I'm feeling more fatigued? How do I really determine that this is something I should really go get addressed? Or am I just kind of shooting at straws?
And that's a lot of things that women do. Oh, I'm just getting older. Oh, I'm menopausal. You don't know. We very good at advocating that women should go once a year. They have their mammogram. I'm also suggesting that women once a year go in and have their heart checked, have their 10-year cardiovascular risk assessed, know what their numbers are, know what your blood pressure is running, know what your cholesterol numbers are, know what your BMI numbers are. That has a lot to do with your overall cardiovascular risk factors. But you have to go in and let them know. You know your body better than anybody else. And the level of shortness of breath and fatigue is going to be different from your typical, I'm just getting older.
Okay. So be really honest with ourselves too.
Yes.
And respect that we know our body. And I think sometimes there's the feeling, oh, I don't want to make a big thing out of it. I don't want to bother the doctor. I don't want to bother maybe the ER because it's feeling really a little differently today.
Well, the thing they have to remember, the biggest thing is we cannot pour from the empty cup.
Mm-hmm.
If we are giving and giving and giving and don't take time to help ourselves, how are we going to help anybody else? You know your body better than anybody else. You know when that level of shortness of breath and that level of fatigue, something in your psychic will say, something is not quite right. Learn to listen to that. Let the doctors and the experts rule that out and not self-diagnose. Oh, I'm just getting older. Oh, I'm menopausal. Oh, I got too much going on. No, leave it to them. But you have to bring it to them and let them know. You rather go to the hospital and it be nothing than not go.
So, a very interesting situation for you, Therese.
Oh, yes.
Were you listening to the same advice for yourself? Because you had a very critical situation occur, right?
Yes, I did not listen to my own advice. I'm very good at giving. With me, I didn't seem like I had any of the traditional risk factors for heart disease. Blood pressure is well controlled, cholesterol is well controlled, no family history, no diabetes, not substantially overweight. So I didn't see myself as a typical cardiac candidate. But after I had workup for my cardiac surgery, the initial surgery, and they did the angiogram and found a significant blockage in one of the main arteries to my heart. And I'm like, okay, where did that come from? And when they questioned me about it, you sure you haven't had any chest pain? I'm like, never, never had any chest pain. But looking back on it now, I realized a couple of months before my surgery that I had noticed I was slowing down, that I couldn't keep up with hospitals rounds like I had before, that when I would get home, I was way more tired than I had ever been. But I'm thinking, I'm working a full-time job. I'm in graduate school full time. I got my hands full like most women do. And because I didn't have traditional risk factors, I didn't think
Yeah.
I was a candidate. No one in my family had ever had heart disease.
Yeah.
So I'm laying there with this 80% blockage, this ticking time bomb that I did not know.
Wow. So fortunately, it was found before it was catastrophic.
Yes. And a lot of times when we see women is after or during an event, because they dismiss, like I did, a lot of these subtle signs and changes. And it's not until they come start having chest pain. And I think with a lot of women, the chest pain maybe comes much later at that critical stage as opposed to in the beginning, where we can catch it before it causes heart damage.
Yes.
So I think a lot of times when we see them, they've already starting to have some chest discomfort, but I think that comes toward the end,
Mm.
that there was some warning signs leading up to that that they, like myself, just dismissed.
Yes. So hard underscore here. Pay attention to these. Do not dismiss
Yes,
them.
do
Better to go
not
get
dismiss
it
them.
checked and be wrong than to let
Yes,
something slip by and it be catastrophic.
yes. And like I say, know your numbers. When
Mm.
you see your physicians, encourage them to do your 10-year cardiovascular risk score. So you know where you are. What is your 10-year risk? What is your lifetime risk of cardiovascular disease? And you work on minimizing as much as you can, because a lot of it can be modified, but you have to know what your risks are.
So you're saying some new language that I've not heard before, which is wonderful. You're educating us. I think that probably is hooked onto your role as this Go Red ambassador this year,
Yes.
right?
To get the word out, know not only your numbers, but know your overall cardiovascular risk, both for 10 years and a lifetime.
Wow. Thank you. Look at what we're sharing with our listeners today. We're getting a step up and we're going to really get this under control.
Yes, we have to, because heart disease is the number one killer in women. A lot of times women focus on breast cancer. Breast cancer does cause a lot of deaths, not to minimize that, but the number one killer in women is heart disease. And women need to know they are at substantial risk and they have to pay attention to their bodies, talk to their doctors, know their risk factors, and help reduce those numbers.
And there are certain categories, you yourself as a Black woman have a higher risk factor, even though you were doing well, everything was fine.
Yeah.
But Black women are at a higher risk. Is that not so?
Yes, I
Yeah.
think they are. And then a lot of it too is lifestyle.
Mm.
How we eat and not being, as active as we should. We think, oh, I'm not at risk for heart disease. It doesn't run in my family. Like I thought, anyone and everyone with a heart is at risk for heart disease.
Good
And
point.
then, we need to start focusing more on women, because there's not enough research out there that looks at our unique needs as women. So
Yes.
we have to really draw attention to women and heart disease, realizing that they're going to present a lot different.
Hmm.
They're going to present a whole lot different. And women have to be their own advocate. We have to speak up and demand that we are taken serious, that these complaints are not easily dismissed.
Right. Yes. And really be firm about that. If someone does try
Yes.
to deter us, like, oh, not so bad. No, really trust our own instincts, our own
Trust
bodies.
your gut, your instinct. You know your body.
Yeah.
You know when something is wrong. Be adamant.
Yeah.
I know something is just a little off,
Mm-hmm.
and stand your ground.
Darn right. Yes. Well, so for yourself, Therese, how are you doing today? You're active with Go Red. How does your body feel? How are you feeling?
It's a process recovering from a major surgery. Every week is getting better than the week before. I
Mm,
think I'm closer to being 100% better than I was. I was quite surprised that it takes months to really get back to your old self again, because I thought I was relatively healthy going into the surgery, that it wasn't going to take me that long, that I was just going to snap back and all was going to be well. That is not how it works. Every week got a little bit better. You have a few aches and pains, but you work through it. Cardiac rehab is also instrumental. It helps
mm,
you get back to that level of functioning, that you can get out and do something and not be afraid that you're going to have an event. So I definitely advocate for women, stay active. If you have something major, have that cardiac rehab. It can help save your life. The other thing women need to know is what to do in case if they think they're having an event. What do I do? One thing they should always do is, people don't take enough time learning CPR. Everybody should learn CPR.
mm-hmm.
Not just people with risk factors, everyone. Because not only can you save your life in the family, but you can save someone else. I taught my kids CPR when they was about 12 years old.
Wow. Great. And they still are knowledgeable. They would feel
Mm-hmm.
comfortable, yes, doing it.
Yes.
Wow.
Yes.
Good mother. Good mom.
They have to learn. Everybody needs to learn CPR, because you don't know who you can help, a life you can save by just doing something that simple.
Yes. Yes. And do not be deterred by thinking it's something that's too difficult or beyond
No.
ourselves.
No,
It's
no,
really
it
simple.
can be done. And the earlier you do it and initiate CPR, the better.
Hmm.
So if you can just get it started till help can come, that's a big difference. That can make a big difference in that person's outcome.
Yes. And I've been privy to hearing some of those stories over the years where even a teenage son was able to do that for his mother until
Yes.
aid arrived.
Yes.
Yes, saved her life. Yes.
Yes. And
Yes.
that's why it's important that people in your family know how to do it. One holiday season, I bought all of my CPR stuff, and I trained my cousins and my siblings on CPR.
Hmm.
This is what you need to do in case someone needs it, because you never know where you're going to be and what's going to happen. And they need to at least have a working knowledge of what they can do.
Yes. Wow. Really strong words of wisdom with that, which again weaves right into being a Go Red ambassador. However, I think this is your passion aside from really being involved as an ambassador
Yeah.
for Go Red for Women, right? You're just adamant.
I want to save as many lives. If I can save one life by the end of my nursing career, then it is all have been worth it.
And no doubt you've already done so. You perhaps aren't fully aware or will ever be aware of how all that you have been encouraging and teaching really has affected someone's life.
I hope so. I really hope so. This is what keeps me doing this every day, year after year, is trying to make a difference.
Mm.
Definitely trying to make, and more so make a difference with women, because I find that women have been greatly ignored in a sense when it comes down to healthcare. That not enough attention has been drawn to the special needs of women.
Mm-hmm.
And that's what I want us to start really advocating for ourselves. Demand a seat at the table. Demand that we be included in a lot of these large scales clinical trials that's going to be the foundation of what we're going to do and how we're going to treat people. Women have to demand to be a part of this. And I don't think enough attention has been drawn to women and women needs.
Mm-hmm. Yes. And so is this part of your platform with Go Red for Women and the ambassador role is doing this?
Yes,
Yes.
is to thy own self be true. That's what I want women to learn. To thy own self be true. You have to be true to you, and you have to demand that you get the care that you need and that your concerns are being addressed.
Yes, absolutely. So this is, this is the whole push. We make a big splash, if you will, on Friday, February the 6th, because we really want that message, Go Red, to be seen everywhere, that we all are going to get on that bandwagon, right?
Yes, yes, we are.
You're leading the crusade in Bellingham.
Yes, I am. In fact, I have already ordered my Go Red t shirts. So for the entire month of February,
Mm.
every day I am going to wear a t-shirt that says Go Red for Women, Heart Disease Awareness. Every day for the month of February, I am wearing red.
That is so great. Yes, why just this one day? I mean, the one day is important, but as you
Hmm.
say, this
So it's going to be a different t-shirt every week.
wow, good for you. I mean, you're
Yep.
really putting uh, your you're putting action to your words. This isn't just like, oh, it's a good idea. No, you're like right in there, hook, line, and sinker.
Oh yeah, because
Yeah.
we don't realize how many women are dying from heart disease.
Yeah.
And that's something we can change, but we have to change it together.
Mm-hmm.
We
Yes.
have to change it together.
Yes.
So
And
yes, I have my whole week, my whole month planned. Every week, I'm gonna have to send y'all a photo of every week a different shirt that I'm wearing.
yes. Well, that's why the social medias these days are so great. That's
Mm-hmm.
one of the really big positive things is to be able to really show that to the world, keep
Yeah,
up with that,
spread the
right?
word. Spread
Yeah.
the word.
Mm,
Yes.
yes. So uh, with and I love that in terms of your doing that encourages us, to maybe if we don't have the t-shirts, but at least be wearing red and maybe someone will notice, oh my goodness, you're wearing red a lot right
Or
now.
wear a pin. You can get a little
Yes.
small heart pin
Yeah.
that can draw attention. So, I've used some of my networks. I've talked to a friend of mine who lives in Dallas, and she's going to bring that awareness to her church. I've spoken with my mother, and she's going to bring the awareness to her church. So, I'm reaching out to those in my small circle to get the word out to other women wherever they meet them that this is important.
Yes. Yes, absolutely. So we can do that. We can go online, right, and get the t-shirts or the pins,
Mm-hmm.
as well
Mm-hmm.
as find out more information as to how we can become more informed, maybe beyond just making sure that we go to the doctor and get our numbers and know
The
that.
American Heart Association have a number of very helpful resources for the community. All they have to do is go to americanheart.org, and you can find a number of things to share not only with yourself but your community. If you are instrumental in any clubs or any small groups, spread the word.
Ye-
Spread the word.
yes. Wow. So you were always passionate about this, but then it was really underscored by your having your own heart event. And
Yes, it
then,
brought it together.
yeah, yeah.
It brought it together.
And are you, are you back to work? At
I
even
am back to work.
you are.
Hmm.
Wow. Which is
And it's been good for me, and it's been good for a lot of the patients, because now they understand. It's like, oh, the relief, someone who can understand some of the things that they're going through, the
yes.
fear and how long it takes to get back, and what to expect. And it kind of gives them some hope,
Mm-hmm.
that, okay, if you got through it, then you know what, I can get through it too.
Yes. Yeah. And you probably even comfort them in that way, saying that you did it, it's
I
possible.
did it. I can tell you exactly what that experience is like. It is doable. Things to be aware of, how to help yourself.
Mm-hmm.
And that's one of the biggest things, is people just don't know how to help themselves. What kind of things that they can do to make this process a lot easier. And it was things that I didn't know until I went through it. I didn't know, when you have heart disease and you have a major heart surgery, you need a village. This is
Mm.
not something you can do by yourself. You need a village.
And I guess that makes sense. Our heart is so critical. We might have a hip surgery. You can get around, but heart, that that affects really everything in our
Everything.
yeah.
If that's not working, nothing else is going to work.
Mm.
And it's just the little things that you're going to need help with. Just something as simple as bathing. When you've had heart surgery, it's impossible to do that by yourself, because you can't raise your arms above your head.
Yeah.
You don't have the energy to stand and cook. So that's why you need family and friends who can either cook and bring meals to you that you just have to microwave, because you can't stand there and do that.
Mm-hmm.
You need someone to help you just getting in and out of the bed. I did not realize it was going to be that much of a challenge, but it was, because you can't use your arms. So
Ah,
just to roll over at night, I needed help and assistance.
my
I would have
goodness.
never, that never occurred to me.
Mm-hmm.
With women, the thing that women need to realize, especially women with large breasts, when you lay down, the breast tends to fall outward, which can put a lot of stress on your suture line. So women need to be aware. Get you a soft cup bra that can hook in the front to give you some support. And a lot of times women don't think about that.
Yeah.
Male doctors don't think about that.
Right. Yes.
That's important. That's important.
Yes, absolutely. And
Yeah.
if you didn't have this feminine information being brought forward, a woman would then, with a male doctor, would
Hmm.
just suffer through it and
Yep.
figure that's just something I have to live with. But you
Hard with the
don't.
coast. Yes.
Yes.
No. Minimize that as much as possible. You're going in to have this surgery. Get you at least two or three bras that hook in the front, that are very soft cuff,
Mm,
because it's going to be too uncomfortable having something too tight and restrictive,
yeah.
that will give you some support so it's not pulling on your incision,
Mm,
because that can be uncomfortable.
wow, that's incredible.
Yeah.
Boy, you, it's so terrible to have to deal with a hard event as you did. But from all that you're sharing, it's like there was a gift in there that you're
Yes.
able to educate and inform so many more, well, all women, because we have to figure there's a potential there of having a heart attack or heart event of
Hmm.
some kind.
Same thing with the stroke. Not only when we think about heart disease, we think about heart disease, but we also think about stroke. You need a village. And that's the most important thing people have to realize. This is not something you do by yourself.
Mm-hmm.
You
Yeah.
going, because women, we think we're tough, we strong, we can handle this. We handle the household and the kids and the children and the job. With this, it was totally different. I've been always very, very independent, but this taught me how much I needed some help.
Mm, yes.
And we can't be afraid to ask for the help that we need.
Right. Because if you didn't, you're just going to put yourself, 10 steps back or a mile
You would,
back, right?
you'll end up back in the hospital with
Yeah.
complications, and
Mm,
that's what you want to minimize.
yes.
That's what you
Right.
want to minimize. So
Oh.
yes, reach out and make sure if you have time to, get your village together. If you know you're going to have this kind of surgery, make sure you get your village together before you even get to the hospital.
Mm-hmm.
It will make your recovery so much easier, and
Yeah.
it will help you get back on your feet so much faster.
What an amazing experience.
It was an eye opener because
Yeah.
being a provider and now having been thrust in the role of the patient, it was different. It was
Mm-hmm.
totally, totally different because now I'm looking at it from a total different angle. And it was kind of shocking. I've heard patients talk about when they hear the diagnosis that they would always go deaf. And I'm like, damn, what patient's talking about? I understand that now. Because although I had an idea that I was going to need surgery, when I heard my doctor say it out loud, it's like my ears stopped working. I could
Mm.
hear nothing else he said. All I can do was sit there and think, they want to cut open my chest. It's like I was stuck right there.
Mm-hmm.
I couldn't think of any questions to ask. It wasn't until a day or two later, I'm thinking about all the questions I should have asked. That initial, just hearing it out in the atmosphere, your hearing will shut down. You won't hear nothing else. Sometimes it's good to have somebody else with you.
Exactly.
Yeah.
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 So that's another component of this. If you're going in
Yeah.
for a serious discussion, yes, bring along a friend.
Need
Friend.
another set of ears. Yes, it's
Yes.
exactly.
Well, you are just this font of wisdom. Again, so sorry that you had to go through such an experience going through heart surgery, but it seems that it's been invaluable in terms of so
Yes.
much that you've gathered from this that you are imparting as education for other women to really heed and use to our benefit.
Yeah, this whole experience, if it made me a better provider, and if that's going to help further better patients and get the word out, then it was worth it.
Mm,
It was definitely worth it. We just have to get the word out.
yeah.
And women have to realize any woman who has a heart is at risk for heart disease.
Well, those are very strong words to really wrap this up with.
Yeah.
And I'm just so appreciative of you, Therese Dumas, for what you've been through and how you can be so articulate about saying what needs to be done and being an ambassador. You are obviously the right person in this role this year, doing phenomenal education. So, again, if people are wanting more information, where do we direct them?
They can go to the AmericanHeartAssociation.org and they will find all of the information they need. I thank you, thank you, thank you, and thank you for spreading the word to women to get out there and take care of themselves, put themselves first, remembering that to thy own self be true, and we cannot pour from an empty cup.
Thank you for being here this morning to meet these special guests, sharing key insights into our health, thus our life. My hope is that something resonated and will inspire you to some self-care. Please check this station's website for the podcasts for more information about these guests, and please share the stories with your family and friends. I'm Kate Daniels. If you'd like to connect with me, simply send me an email, katedaniels@hubbardradio.com. February might be considered the month of love. Find where you can share that love today.
Thank you for listening to Inspirational Women. Tune in every Sunday morning at this time to hear about those truly empowering the Northwest community, all for the greater good. Sunday Morning Magazine and Inspirational Women are a public service of Hubbard Radio Seattle.